Hi there, my name is Adam Jackson. I'm a veterinary surgeon at Liphook Equine Hospital, and we would like to present to you a small tutorial on colic. So the first question to be addressed is, what is colic? And colic is abdominal pain. And it must be noted that this is a clinical symptom and not a diagnosis. The term colic actually encompasses all forms of gastrointestinal conditions that cause pain, as well as it can cover other abdominal pain that does not involve the gastrointestinal tract. The most common causes of colic, however, is gastrointestinal in nature and are often related to colonic disturbances. There are a variety of different causes of colic, and some of them may be fatal without surgical intervention. Among domesticated horses, colic is the leading cause of premature death, with the incidence of colic in the general horse population being estimated between 4 to 10% over the course of an average lifespan. The conditions that cause colic may be life-threatening and can happen in a very short period of time. So please don't be afraid to contact your vet if you have any suspicions or concerns. So with respect to true colic and false colic, we do need to determine if it is a false colic or true colic being associated with the digestive tract, and this must be differentiated from a false colic, which is pain in the abdomen, but not associated with the gastrointestinal tract. To drive home the importance of differentiating between false colics and true colics, this is why a clinical examination and a thorough history must be taken, because other diseases can be occurring, such as pleuritis, peritonitis, hepatitis, which is liver dysfunction, or bile duct inflammation, pancreatitis, cystitis, or urolithiasis, which are gallbladder stones or bladder infections or inflammation, any complications associated with pregnancy. Sometimes laminitis can come across as colic symptoms, tying up, and things associated with the ovaries, such as ovarian tumors. We, as veterinary surgeons, often differentiate colics between mild colics, moderate colics, and severe colics. So mild colics, the usual symptoms are the horse is stretching his abdomen, really stretching out, looking at his flanks frequently, grinding the teeth, yawning, and sometimes the males will protrude their penis. You will not have all these signs together. You may have combinations of these signs. Strictly speaking, colic refers only to signs originating from the gastrointestinal tract of the horse. Signs of colic may be caused by problems other than the GI tract as well, such as problems with the liver or the ovaries, the spleen, the urogenital system, pleuritis, or pleuropneumonia, as well as things like uterine contractions, laminitis, and exertional rhabdomyolysis, such as tying up, azoturia. Colic has even been seen as secondary pain to kidney disease, but this is rare. Severe colic, you'll get all those signs again that we just mentioned, plus you'll get profuse sweating. They'll be rolling a lot. They often have self-inflicted trauma from getting up, getting down, and rolling. And patchy sweating, which is often seen with grass sickness, a cause of colic. So it is vital that colic has veterinary clinical evaluation, and the evaluation must be thorough and systematic. And the first attending veterinary surgeon may not come to a diagnosis immediately, but their primary goal is not only to make the horse comfortable and help it recover, but to determine if the condition can be treated surgically. So clinical evaluation is important by the veterinary surgeon so that the clinical symptoms and findings can all be put together to determine if this horse requires surgical intervention and needs to be sent to the hospital. If it is a severe colic, the prognosis, the outcome, decreases after about 8 hours if there is irreversible gut damage and endotoxemia starting up. There are usually quite a few parameters that the veterinary surgeon will use to determine, is this a medical intervention or does it require surgical intervention? And these are things such as the color of the mucous membranes. They should be pink, sort of a salmon pink, but if they're sort of a dark brick red or blue, that is very, very serious. The heart rate should regularly be in its 20s, but low 20s, but we get concerned if it's above 60 beats per minute. Respiration, we do get concerned about. That should be about 8-10 breaths per minute, but if we're getting into 30 and above, we are slightly more concerned. Gut sounds, we listen to 4 locations in the stomach, 2 on each side of the abdomen, and if we can make sure that there are gut sounds present. Rectal palpation, we might feel something such as a torsion or something like that. That helps us decide if we need to send the horse away. And the temperature, 37 to 38 is normal. Anything above 38, we start to get nervous. 39, above 39, we think it would be of value to send the horse away. And all of these signs are not isolated. We put these signs together. So if we have a raised heart rate and a high temperature, there may be concerns, especially if we've given them non-steroidal anti-inflammatory drugs such as bute or flunixin, and they don't respond to it. That is another indicator that the horse may require surgical intervention. At least be sent to the hospital for a more thorough examination and monitoring. So before we even start, we'll speak to you on the phone and we'll get a good idea of how the horse is presenting. And we will ask a few questions such as the age of the horse, the sex, the breed, and if there is insurance involved that may help us. With respect to the insurance, it's merely just so we know that if we need to put a claim in, that we can get on that ASAP. With respect to the age, breed, and sex, that can sometimes give us an indication of the potential causes of colic so that we are sort of prepared to tackle those potential problems. Although I would argue that the first attending vets are well equipped to really deal with any sort of colic, at least the triage and the first aid treatment. And if they need to be sent away, well, those are matters that the ambulatory vet can sort out to get them on their way to the hospital. Now, when the vet arrives on the yard, no doubt you'll likely be distressed and worried, but the vet may not necessarily jump right in and treat the horse. Sometimes we even take a step back and just watch the horse's behavior, depending on the circumstances, just to see exactly what is being presented, because sometimes that can give us some clues. And we must take a history, and I know, again, it's distressing when we're asking you all these questions because you want your horse helped, but these questions can be so helpful in determining what's happening, the diagnosis, what sort of things we need to do, and so we can be judicious on our choices of helping your horse and making the best choices for your horse. So we'll ask things such as, when did you first see these signs? And how long have they been going on? And how fast have they been progressing? And then we'll be asking things like, have they been drinking or eating? And what have they been eating? What their management is with respect to stabling and being out on the paddock. And then we will ask about urine output or fecal output and what maybe the feces looks like. We'll also ask, has there been other episodes of colic recently associated with this horse or in the past? We'll ask if there's been any weight loss, or has the horse seemed dull, depressed for a while, or has it been a sort of quite sudden onset. We'll ask things about worming programs, and if there's been any recent changes in their exercise programs, management, or diet. And obviously we'll consider things like seasonality. So the first thing we'll look at after all these questions is the mucous membranes. So these are the gums. And we look at the color, and we want them to be sort of a salmon pink, a light pink. And that's normal, whereas if we get a red, a brick red, then we're getting what we call hemoconcentration and vasodilation of the capillary beds. And this is often due to endotoxemia, which is toxins being released from problems in the gut. Then they can become brick red, which is further deterioration, which is really suggesting they need to go to surgery. Then we get this sort of toxic brown red look, which is endotoxic shock, so we need to treat that. And cyanotic, which is a grave prognosis and likely euthanasia, and that's when they sort of go a bluey color. So the next thing we do is capillary refill time, and this is where we will push our finger against the horse's gums and we make them go white, and then we'll take our finger off and we see how quickly they return to their normal pink color or their red color. And it should be under 2 seconds, but increasing capillary refill time does indicate poor perfusion, so can suggest endotoxic shock. Also, it allows us to determine hydration status if the gums feel very tacky and dry as opposed to moist. So the next thing we do is we auscultate the heart. So we put our stethoscope onto the heart. This is just behind the left elbow. That lets us listen to 3 areas of the heart, and then we can go to the right side and we'll listen to 1 area of the heart. But most importantly, what we're trying to determine is the heart rate. Now, we like the heart rate around in the 20s, but with colics you can have heart rates that are high, but if they're below 60, then they're rarely serious. But if they're between 60 and 80, then that is a bit more serious and does require attention. Heart rate between 80 and 100 beats per minute, that is severe, and then a heart rate above 100 really is very severe and likely irreversible. So these are clues that help us about making that decision, can we treat them medically or surgically. Sometimes your vet may note a heart murmur during this condition, and sometimes the heart is working quite hard and it is under quite a lot of stress, so murmurs can result. But it doesn't necessarily mean that murmur has always been there, and if all goes well and the horse gets better, often that murmur will go away. But it is of value, if that's the case, that your vet checks the horse maybe a week later and ensures that that heart is working fine. Also, the next thing we do is check digital pulses, and this allows us to determine how much blood is getting to the outer periphery of the body. So an increased pulse rate down by the legs in the fetlock or the pastern can show that potentially if there's a bounding prominent pulse, that there's endotoxemia that is potentially causing a secondary laminitis. Also, as a little hint, it's not the be-all or the end-all, but we often will feel the feet, and if they feel quite cold, then what that is telling us is that there's poor perfusion to the distal parts of the body, suggesting possibly dehydration. And with respect to hydration status, like I said, we will check the distal limbs and we will check the skin tent. So we'll pull a little piece of skin on the neck and let it go. And if it goes back quickly, we know the hydration status is good. But if it's very slow to return, then it does suggest possibly dehydration in combination with the dry gums and the cold distal limbs. So increased respiration rate is seen in colic, and it's usually associated with pain. The pain is inducing this increased respiration rate. But sometimes the distension of the guts and can compress the diaphragm, which causes labored breathing. Auscultation of the abdomen is a step that we take, and this is subjective and non-specific, but it is useful. And we are typically auscultating the abdomen in 4 quadrants. We have the upper flank, the right side, which corresponds to the cecum, the lower right side, the caudo-ventral abdomen area, which corresponds to the colon, the upper flank left side corresponds to small intestines, and the lower left side, the caudo-ventral abdomen, corresponds to colon. Each quadrant should be listened to approximately 2 minutes, and we're listening to gut sounds called bulbarygmi correlate to the motility of the bowel. And the vet does note sort of the intensity, frequency, and location of these gut sounds. If we hear increased gut sounds known as hypermotility, where the guts are working overtime, this often indicates spasmodic colic. Decreased sounds or no sounds may be suggestive of more serious conditions such as ileus or ischemia, and persistence of hypermotile bowel often suggests the need for surgical intervention. Gut sounds that occur concurrently with pain may indicate obstruction of the intestinal lumen, but we also do abdominal percussion pinging, where we just hit have the stethoscope on and hit the sides of the abdomen, and we're listening for any signs of gas distension in the bowel. We also look back and quickly checked if there's any muscle tremors, because slight tremors can occur in colic, but particularly in horses with grass sickness, they can have muscle tremors, what we call fasciculations of the triceps and the flank area. The next step is rectal temperature, and the normal temperature that we prefer is between 37.2 and 38.3. It does vary a little bit with breeds and age of horse, but we do get concerned if the temperature is above 39 degrees. We do quickly evaluate the feces. We see if there's how much there is. If there's very little or no feces, then we're worried about some more severe conditions such as ischemia conditions or grass sickness. We also check the feces for consistency. Is there blood, worms, sand, or mucus in the feces? And mucus-coated feces, it sort of has a slimy outer texture, does suggest that there's a long transit time of this feces moving through the intestines, and is commonly seen with grass sickness. So the next step is we do a rectal palpation, and this is an important and helpful part of the process, but you must bear in mind that the horses are very big, and that often we can really only feel the back third of the abdomen. There's 2/3 that we can't reach, but it certainly can be helpful, and there's a lot of things we can feel, and there is sort of a process that veterinary surgeons do when they're in there going sort of circular and feeling various structures, and so it's quite methodical and can be very, very helpful. Sometimes we'll give a horse a little bit of buscopan, which is often used for spasmodic colic, but we will do it just to relax that area so it's not terribly distressing for the horse as we do it. We try to avoid sedatives, but on rare occasions some horses do resent it, and I don't blame them, and we give them a little bit of sedation just to get the worry away and make them as comfortable as possible when we do this process. So the next step is passing a nasogastric tube, and it is useful both diagnostically and therapeutically. A long tube is passed through one of the nostrils, down into the esophagus and into the stomach. Water is then pumped, roughly 10 liters of water into the stomach, and then we'll try to siphon some back to see how much we can get out of the stomach. And generally it's okay if you get maybe less than a liter back of gastric reflux, but more than 2 liters back is of concern and is significant. Just remember, horses are unable to vomit or regurgitate. Therefore, this nasogastric intubation is therapeutic because it can cause gastric decompression. Now, backing up fluid through the intestinal tract is usually due to a downstream obstruction like ileus, or an obstruction or proximal enteritis, and its presence usually indicates a small intestinal disease, generally speaking. And generally, the closer the obstruction is to the stomach, the greater the amount of gastric reflux you will get. Approximately 50% of horses with gastric reflux do require surgery. So at this point, depending on how the horse is responding to treatment and the conclusion the veterinary surgeon has made, the vet may take some blood samples and some fecal samples in order to analyze, and we will look at various workings of different organs and also see if there's the presence of anything untoward in the feces, such as worms or some different types of bacteria that could be causing disease. However, these tests may be reserved if the horse is being sent to the hospital, that it is done by the hospital staff, so they can do it there and then. So this brief chat tutorial is just really about colics out of the stable, and what you and your vet will be doing together to help the horse and to make some decisions on the course of action that we take. We do hope that this has been helpful. There'll be more tutorials coming your way, so do keep an eye out on colic and other topics. And I hope you enjoyed it, and wishing you all the best out in the horse world.